Hi, Dr. Eric here, the fitness physician, and in today's world, stress is everywhere, and we may not be able to avoid it, but we can influence how it affects us. There is an agenda out there to keep people stressed out through fear-mongering, news stories, conditioning people to feel helpless and codependent on the government, and a sense of powerlessness over their own health. The agenda by the powers that be is to make people as passive, low energy, fatigued, sick, and unmotivated and weak as possible in order to control them easier. It's just the bottom line. This is done by minimizing the importance of exercise and outdoor activity, starting in most elementary schools through high schools, and now in getting people addicted to their phones with casino-type programming to keep them indoors looking at a screen all day, right? Most fast food joints are popping up daily, and food delivery services are working all hours of the night, basically make it easier to maintain an unhealthy diet. My mission is to go to war against the powers that be that are on the attack on Americans' health and well-being, and to address the stressors that are crucial to optimizing health on a root cause cellular level, including weight loss resistance. Stress not only damages our adrenal glands, but it heavily influences digestion, brain health and communication, sex hormones, immune function, metabolism, and fat loss. Stress is a modern pandemic. It's the silent enemy. Few things in our modern environment have the negative impacts that stress can have on our body. Yet stress has become the underbelly of almost all forms of chronic disease. No matter what diet you follow, how much you exercise, and what supplements you take, if you're not managing your stress, you will still be at risk for modern degenerative conditions like heart disease, diabetes, hypothyroidism, autoimmunity, and weight loss. Today, there are more physiological stressors in our environment than ever before in all of human history. Studies show normal children today report more anxiety in child psychiatric patients than even patients back in the 50s. And as pervasive as stress is, many people don't do anything to address its harmful effects. Why? Because it's so much easier to not manage our stress. Stress management bumps us up against core patterns of belief and behavior that are difficult to change. Let me just say this. If you're not doing some form of regular stress management, you will sabotage all of your best efforts with diet, exercise, supplements, and more. Stress management is crucial to optimal health and longevity. Now let's talk about chronic health conditions and stress. So what do the top 6 selling prescription drugs all have in common? They're all meant to treat conditions that are either caused by or made worse due to stress, like and cortisol and all the stress hormones. Lisinopril is used to treat high blood pressure, for example. Stress is well known for causing or contributing to high blood pressure. Atorvastatin, Lipitor, etc., they're used to treat high cholesterol. Cholesterol is an anti-inflammatory molecule known to increase during times of stress. Levothyroxine used to treat thyroid conditions. The stress response system directly causes effects on thyroid hormone physiology. Metformin is used to control blood sugar. When people are under mental stress, they generally experience an increase in blood sugar levels. Metoprolol is a beta blocker. It's used to treat high blood pressure, chest pain, heart failure, etc. And once again, studies have consistently demonstrated the impact that stress hormones have on our cardiovascular system, including heart rate, blood pressure, chest pain, and more. Omeprazole, Prilosec, is used to treat heartburn or reflux, stomach ulcers, and reflux, what we call GERD. Stress is a well-known contributor of these feelings of heartburn or gastroesophageal reflux, and there are many, many more. The fact is, cortisol's primary role in the body is to increase epinephrine, which then increases heart rate, blood pressure, blood sugar levels, lipids, including like cholesterol, clotting factors, protein breakdown, which can lead to muscle loss, insulin surges, short-term memory and cognitive impairment, reductions in anabolic hormones, digestion. And there's a lot of things that happens when we're repeatedly exposed to crap and stress, right? And this is an abnormal response. Today's stress comes from high taxes, a struggling economy, attacks on our freedoms, money problems, relationships, work issues, work demands, infections, lack of sleep, food intolerance and sensitivities, all the crap in our food, toxins everywhere, and either too little or too much exercise. So what to do about stress and fat loss, and how we can fight back. So the first thing is to evaluate your symptoms. Generally speaking, if you have difficulty sleeping, allergies, digestive disturbances, fatigue after meals, dizziness, sweet and salty cravings, you've likely got some adrenal stress issues. However, symptoms are rarely an effective tool for determining underlying physiological conditions alone. They can be very helpful though. All the symptoms I listed are also symptoms that can indicate a wide variety of different conditions. Fatigue is one example. Fatigue is a symptom often related to adrenal gland dysfunctions, but fatigue could also be due to all sorts of other problems, such as nutritional deficiencies, various anemias, thyroid dysfunction, hormone imbalances, neurotransmitter dysfunctions, and much, much more. It's important to assess this. While symptoms can be a valuable tool in self-assessment, the preferred method of evaluating your adrenal gland function would be a combination of testing, like where we can test salivary and urinary measurements and more, as well as blood work. This type of testing would involve multiple samples taken over the course of a day or so to determine the exact output, and as well as deficiencies of the total and free cortisol production, cortisol metabolized, DHEA, all of which might impact weight loss, fat burning potential, and more. In addition, it's not enough to simply see that your stress hormones are elevated. You need to dig deeper and determine if your stress is emotional, physical, or both. With Primex Cellular Medicine, you get to the root cause on a cellular level and the right type of testing and someone who understands how to interpret your results and then can get very specific on how to treat it. If conventional medicine is failing you and you want something different, consider working with a cellular medicine practitioner. If you have questions about hormone optimization or losing weight, or any of these issues I mentioned, contact us for more information about our cellular medicine approach to better health, weight loss, hormone optimization, and more, called Primex Cellular Health. Make an appointment with me, Dr. Eric, today. So reach out today. The first step is to schedule that initial consultation. You can contact me at 740-777-9717 or email me directly at eric@drericfate.com. That's DRERICFETE. Or go to my website, drericprimex.com, and check out all my social media pages for more great content, products, and services. Thank you.